Welcome to Project First Line. This module will focus on linen and laundry management as it relates to environmental services. Our attention will be on understanding how the contamination of linen and laundry serves as a pathway for the spread of germs. Then, we will look at the laundry process with the goal of removing and killing germs. We will then end this presentation with some key takeaways. Environmental services workers have many responsibilities and share a critical role in ensuring the safety of patients and workers through actions such as environmental cleaning and disinfection, handling hazardous waste, and, as we will talk about in this presentation, managing linen and laundry. The purpose of linen and laundry management in the healthcare setting is to protect workers from exposure to potentially infectious materials during the collection, handling, and sorting of textiles and linen, and to provide linens that are clean and germ-free to patients. Linen and laundry management is divided into 4 sections. Each section plays a critical role in infection control. These sections are the physical requirements, linen and laundry contamination, the laundry process, and the maintenance of laundry equipment. Let's start with the physical requirements for handling linen and laundry. Looking at the physical requirements, there should be 2 separate work areas. A dirty area for collecting, sorting, and washing, and a clean work area for drying, folding, and storing. This helps maintain cleanliness and reduces the spread of germs. Additionally, the dirty area should have negative pressure to stop germs from spreading. The work area should include hand washing stations. Hand hygiene is especially important since you are going back and forth between work areas, which makes it easy for cross-contamination to occur. Personal protective equipment, or PPE, should be readily available in your work areas. Some examples include gloves to protect hands from hazardous objects, using masks to protect from any germs in the air, and gowns to protect the skin and clothing from germs. We'll now look at how contaminated linen and laundry contribute to germ spread. Let's take a moment for a discussion question. What does contaminated laundry mean to you? You may want to pause the video at this time before continuing to the next slide. The Occupational Safety and Health Administration, or OSHA, defines contaminated laundry as laundry which has been soiled with blood or other potentially infectious materials or may contain sharp objects. Let's now look at how contaminated laundry poses an infection control risk. Dirty linen and laundry may carry contamination from blood, vomit, urine, stool, and bodily fluids, making them reservoirs for harmful germs if not cleaned properly. These germs can then spread to another place or person through touch, especially the hands. But it also happens when dealing with the laundry itself, when it is moved or if it is shaken. Germs can travel in the air and can get into a person's eyes, nose, or mouth, or into a cut or a break in their skin and cause infection. Let's discuss an example scenario of how germs spread and make people sick. In this scenario, The germ moves from a patient onto a bedsheet, making the bedsheet a reservoir. Now, let's say a healthcare worker steps into the room to assist the patient with getting comfortable. While helping the patient, the worker touches the dirty bedsheet. After handling the dirty and used bedsheet, the worker does not clean their hands. Through the pathway of touch, the germ has moved out of the reservoir and onto the worker. Now, the same healthcare worker has stepped into another patient's room, touching the bed rails and fluffing a pillow in the process. The patient in this second room, who also has a weakened immune system, uses the bed rail to sit up before eating, allowing the germs to be delivered directly into their body. This example shows us just how easy it is for germs to spread from contaminated items onto others, putting healthcare workers and patients at risk of infection. Without wearing proper personal protective equipment or following proper hand hygiene, germs easily spread to others. These germs could reach other patients and staff, potentially causing infections to spread within the facility. So, it's important to handle linens cautiously, use PPE, and maintain good hand hygiene to prevent the spread and prevent infections. We will now discuss the laundry process and its role in infection control. The laundry process has two main goals. The first goal is to remove germs, dirt, grime, and stains from the linen and laundry. The second goal is to ensure that the linen and laundry are disinfected and ready for reuse. We split the laundry process into two work areas, the dirty area and the clean area. This helps stop germs from spreading and makes sure that patients and staff stay safe. Here are some important considerations when collecting soiled laundry from a patient's or resident's room. Wear the appropriate personal protective equipment, such as gloves and gowns, when removing contaminated textiles, fabrics, or clothing from areas where contamination occurred. This will help prevent the spread of germs and keep you safe from any hazardous items. Soiled linens should be collected with minimum agitation or shaking to avoid spreading germs in patient care areas. Then, placed into bags or other appropriate containment at the point of use. This means collecting the soiled linen in the same area where the contamination occurred. Never transport soiled linen by hand outside of the specific patient care area from where it was removed, as this poses a risk of germ spread. Bags should be securely tied to prevent any spills or leaks. Bags containing contaminated laundry must be clearly identified with labels, color coding, or other methods, regardless of whether the laundry is transported within the facility or destined for transport to off-site laundry services. This is to prevent any potential cross-contamination. Let's move on now to discuss how we transport soiled linen. Here are recommendations for transporting soiled linen. Because soiled linen can potentially contain solid excrement and body fluids that can leak, it's important that you do not transport the soiled linen by hand outside of the specific patient care area from where it was removed. Before transporting, securely tie or close the bag containing the soiled linen to prevent leakage during transport. If clean and soiled linens need to be transported together, Make sure that they are separated at all times to avoid cross-contamination. Loose linens should never be tossed into chutes or placed on top of carts. This helps prevent the spread of germs. We'll now move on to sorting the soiled linen. Before you begin sorting soiled linen, putting on appropriate PPE such as a gown, mask, eye protection, and rubber gloves that can resist needle sticks is important for your safety. You should always be prepared for objects that may have been accidentally mixed with soiled laundry, like scissors, needles, and patient property, like dentures, glasses, and hearing aids. Sorting should be done by the soil content, fabric and fiber type, weave, and color. This step helps reduce contamination of clean fabrics so that the soiled bedsheets are not mixed in with dirtier items, like towels. Additionally, sorting before washing allows you to customize the detergent based on the fabric instructions, making it more effective in removing and killing germs during the washing process. You also save time with folding and storing. Last, it's important that sorting is done in designated laundry areas and not in the patient room. Germs can spread in the patient care areas. When washing, wear PPE before directly handling the linen and laundry, and treat all soiled linens as hazardous. Laundering cycles consist of flush, main wash, bleaching, rinsing, and souring, which is when a chemical is added to clothing during the final rinse cycle of a washing machine to lower the pH of the water and to assist with the removal of detergents and rust stains. Souring also inactivates some microorganisms and reduces the risk for skin reactions among patients. Fabrics, textiles, and clothing are disinfected during the laundering process from the combination of mechanical, thermal, and chemical factors. To wash effectively, manufacturer instructions should always be followed to ensure that the proper temperature, detergent, and additives are used. The next step is drying. The drying process is just as important to follow as it removes the moisture that germs need to survive, which is why we should never leave textiles that are damp in a machine as it can result in microbial contamination. To successfully achieve drying, it's important to follow the recommended cycle times and dryer temperature. The dryer should also be properly maintained according to the manufacturer's instructions to prevent microbial contamination of the laundry equipment. When it comes to folding clean laundry, make sure to fold the clean linen in the designated clean area. You should follow a process or a one-way flow to ensure that clean clothes are never in a designated dirty or soiled area. There should also be some sort of a functional barrier between dirty and clean linen areas to reduce any cross-contamination. Proper hand hygiene should be completed before you begin to fold to reduce the spread of germs to these clean items. As you begin to fold, it's important to not shake or agitate linens and laundry to reduce releasing lint and fluff, which can add to dust buildup, an environmental reservoir. In this clean area, you need to ensure that all surfaces and equipment used are cleaned and disinfected regularly with an EPA-registered healthcare disinfectant to reduce the spread of germs and to prevent cross-contamination. Properly storing the clean linen and laundry may seem like a small step, but it can have a big impact in stopping the spread of germs. Again, Follow proper hand hygiene by cleaning your hands before handling clean linen to reduce the spread of germs. When transporting items, they should be covered to avoid contamination, and they should remain covered when placed in designated linen storage areas. These designated clean areas should be cleaned and disinfected regularly to prevent contamination. By using proper hand hygiene and keeping storage areas clean, we protect the clean linens from germs. Here are some special considerations with the laundering process. Linen carts that only carry clean linen should be disinfected on a regular basis, typically each time that the cart is emptied. Containers, covers, and liners used during the laundering process also need to be cleaned and disinfected regularly with an EPA-registered disinfectant to avoid contamination. Regular equipment maintenance is essential to prevent germ spread. For example, during the washing process, if the washing machine isn't functioning properly, it can become a source for germs, potentially leaving items inadequately cleaned and contaminating items again. This may require for you to communicate with a supervisor to report the issue. Make sure to follow your facility guidelines on how to report maintenance of equipment and any equipment concerns. Last, be aware of the germs in your community and facility to protect yourself and others. Knowing about the germs going around your facility can help you make sure that you use the appropriate PPE when handling soiled linen and that you are using the best detergents, disinfectants, and laundry processes to remove germs. Let's review our key takeaways from this module. Laundry contamination is not always visible, so it is important to treat all soiled linens as hazardous. A dirty and a clean laundry area need to be established and followed to stop cross-contamination. Laundry must be maintained clean after washing until it is distributed to the patient or resident. Following a standardized laundry process removes germs, dirt, grime, and stains from the linen and laundry and ensures that they are disinfected and ready for safe use. And last, regular maintenance and cleaning of laundry equipment is an important infection control practice. You can keep exploring these topics on your own using the resources on this slide. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media. Thank you.